Hello, we're the trauma team, and we will conduct a primary assessment of a trauma patient with a suspected head injury, spinal cord injury, and fractured pelvis following a motor vehicle accident. Okay, as a safety approach, we will put on our gloves, our gun, and our goggles, or our eye protector. Okay, got it. Mr. David, how are you doing? My name is Sherryl and I'll be your nurse for today. I'm just going to assess your airway. Can you hear me, Mr. David? The patient responded and he seems not okay because very low voice. Okay, I'll check his airway. Can you open your mouth? Okay, I'll help you. Using the jaw thrust maneuver. The airway is clear. Yeah. Then I'll look and listen for the rise and fall of the chest and also the feel. He's breathing rapidly. Okay, can you grab me the non-breathable mask and put it to 15 liters per minute? I'll stabilize the head. Okay. Can we swap? Okay. Change position. Stabilize the head for me. Yeah. I'll just put the cervical. I'll check if it fits you. Yeah, I think. Yeah. All right.
We can have this one because my roll is flat.
Yeah. It's moving.
Don't move the head. Okay. I'll put this as well to stabilize the head. You can hold this.
Yeah.
Okay, done.
Mr. David, I'm Binu. I'm going to check your breathing. I'm going to check his neck. Yeah, there is no obvious abnormalities in the neck. I can. And trachea is in the center. There's no abnormalities in the trachea too. I'm going to check his chest wall. Yeah, chest is symmetrical. Yeah, chest wall is symmetrical. I can feel his breathing is 28 breaths per minute.
Hello Mr. David, my name is PARVINDER and I am looking after you this morning, and I have my colleague.
My name is Plessy. We are going to assess your circulation.
Firstly we checking that the oxygen and everything is alright. Yes, and after that we checking the blood pressure. Plessy, can you please help me to check the blood pressure please?
Sure.
Yes. By the time I'm checking that capillary refill, and capillary refill is more than 4 seconds and this is not normal. And I'm checking the pulse rate while you're checking the blood pressure. pulse rate is 90 to be per minute, is irregular. And when you finish the blood pressure, can you check that pulse pulse oximeter? Then we check the oxygen level, please.
Yes.
How is the blood pressure?
Blood pressure is 90/60.
She's hypo.
Yeah. I think he need a IV fluid.
Plessy, can you please check the doctor order, and after that we giving him IV fluid.
Yes.
Can you please get his file and let's double check that's all the things. You just need the name and then I will check. It's Mr.
His name is David.
Yes, David.
His number
Yeah.
is 1234.
Yeah.
Can you check his
Yes, I will
here?
check. Yeah,
Can
I
you
will
check the
that.
name?
It's a David,
David.
and 1, 2, 3, 4. And
Yeah,
I think it's the
correct.
right person.
The
And
IV
here we
fluid
will
order
do
is
it.
1 pint of normal saline.
Yeah, 1.5.
Yeah. I did the calculation. The drops is 20 drops per minute.
Yeah,
Can you
22.
connect the fluid?
Yeah, it's already connected, and then I'm going to connect the line. Okay, it's ready. Can you please check the oxygen saturation, please?
Okay. I'm going to check his oxygen saturation. Oxygen saturation is 92.
And up.
It is low.
Look, can you please look the oxygen connection is all
Right,
good?
yeah.
Yes, it's all right.
Going 50
It's
liters
still
per
having
right?
oxygen. And
Alright.
after that, we're going to do a pressure dressing on the leg, his wound, and it's bleeding.
Yeah,
Can
I
you
come.
please prepare that dressing thoroughly, and then we quickly do the dressing?
Okay. I prepare everything for you.
Thank you, Plessy.
Okay. Put the normal saline here. You can do the dressing now.
Can you please help me do this? Try the phone. Can you help me do? Can you please get another tape, please? Yeah. Okay, dressing is done. We're gonna move this kind of. This thing is comfortable. Make sure it's comfortable. Okay, this is end of the circulation assessment.
Now I am going to check the shoulders. Nothing abnormal here. No fracture. No disability. Everything is alright. Now I am going to check his chest. No crepitus. I am going to do the palpation on his abdomen. Do you have any pain? No pain in his abdomen. Nothing abnormal. I am going to check his pelvis. I can see a bruise on his left pelvic region. we are suspecting a pelvic fracture on his left side, so we can apply a pelvic binder. There is no pelvic binder. Instead of pelvic binder, we can use a pelvic splint. Parvinder, can you help me to use the pelvic splint? Can you come to that side? Can you raise his legs? Tight this one. It's alright. And checking with his legs. There is nothing abnormal. Mr. David, can you move his fingers and toes? David, can you move his fingers and toes? Can you able to move the fingers and toes? The fingers. Can you grasp on my hand? Hold it. Hold tightly. Hold in this hand also. Hold my hand tightly. Yes. His hands and toes are moving. Nothing abnormal. Then I am assessing the exposure of my patient. Parvinder, can you check his temperature? Can you take the thermometer?
So David, I'm just checking your temperature. Temperature is 36.8.
Oh, it's hypothermic, I think. Can you take the blanket to cover this patient? Can you take the blanket from there? Okay. Thank you, Parvinder. That's good. Now our assessment is finished. Thank you very much. Now I finish my hand wash. I'm going to do documentation. Now I'm going to do the documentation. The patient chart is to Mr. David. To do the documentation. The patient's chart is Mr. David. His number is 1234. Now finish the documentation.
My gap is that I forgot to check the identity of my patient. You need to identify first your patient properly in order to know if you're dealing with the right patient.
My gap was I forgot to remove my watch before I'm starting my assessments with the patient. I wore the watch with my gloves. It will cause for a cross contamination to the patient. So I think that's my gap.
I saw a gap when Plessy was doing the disability assessment. She did not explore the patient's pelvic region, and and leg properly. And after that, I found that I have one guy because I was not wearing my nurses most of the time because nurses was is most important when you quickly check that observation. That was my gap.
So my gap is that instead of using pelvic binder, I use the pelvic splint. That was a wrong thing for this patient.